Okay, everybody, welcome. So for those of you who don't know me, I'm Christine. I'm one of the nurses in the Neuromuscular clinic, okay? So thanks for coming today. I'm going to start off the talk today with a little overview on constipation and constipation management, and then that's going to be followed by the second part of the presentation with Tiffany, our clinic dietitian, who also presented last week. Okay, and there'll be a lot more in terms of constipation recommendations in her presentation as to fluid and fiber amounts, so I won't touch on that too much, okay? So what is constipation? So according to Howie and Allen 2003, constipation can be defined as difficult and infrequent defecation. So some signs and symptoms that we would look for. So less than 3 bowel movements in a week. So a lot of people think, I need to go every day. That is not necessarily the case. So less than 3 bowel movements per week, lumpy or hard stools, straining to have a bowel movement, persistent difficult or incomplete bowel movements, feeling like you need to have a bowel movement but you can't go, abdominal fullness, bloating or pain. Headache and fatigue can also be a symptom of constipation, and decreased appetite, nausea, and vomiting. So we're going to talk a bit about the role of the bowel in the digestive system. So there's a picture there, and basically it shows that the bowel is part of the digestive system, and it starts in the mouth and it finishes down in the anus. So the role of the digestive system is to digest the food we eat, absorb the nutrients we expel, and the waste products. So the colon, which is otherwise known as the large intestine, absorbs fluid from the waste as it passes through. Waste is moved along with rhythmic contractions that we call bowel peristalsis. Waste is then formed into stools. Stools are then stored in the rectum, which is at the end of the large bowel, until they are expelled. There's nerve endings present in the rectum that tell us when we need to have a bowel movement, and they'll let us know whether it's air or stool. So a normal bowel movement pattern ranges from having a bowel movement 3 times a day to once every 3 days. So everybody's body is different, and we can all have different patterns, okay? So some causes of constipation. So a change in your current diet, decreased mobility, not moving a while or as much as we used to. Overuse of laxatives can also be a major issue. Many medications, some examples of these medications, opiates like our painkillers, Tylenol 3s is a big one, antidepressants, antihypertensives, allergy medications, iron and calcium supplements. A lot of us as we get older especially require to take a lot of these medications, and they can cause constipation. Medical conditions, for example, stroke, diabetes, IBS, intestinal blockages, low thyroid function, decreased pelvic floor muscles, spinal cord injuries, and of course, our neuromuscular patients can also have constipation. Traveling can cause constipation. Pregnancy and stress is another big one too. Now, do we think constipation is relating to aging? The answer is actually no. According to Caution Hudson in 2000, there's no evidence that a change occurs in the bowel motility with aging. The decrease in number of bowel movements in the elderly population is more likely related to factors associated with aging. So example, like we talked about earlier, decreased mobility, we're not moving as well as we used to, multiple medications like we just spoke about, chronic diseases, and poor diets. Diet is huge. So we'll talk about non-medical management of constipation, and this is always where we should start. If we're thinking we might have some constipation, we always want to do everything we can naturally before we go into some of the medications. So the big one too, that Tiffany is going to touch on later, is increasing your fluid and fiber intake. Okay, so another one would be to make sure you're eating at regular times throughout the day. Are we just eating in the morning and then not eating all day, then eating again at night? So have those regular meals throughout the day. Stay as active and as mobile as possible. So increase your exercise routine if you can. If you're having some issues, are you able to walk a little bit longer? Can you do a 15-minute walk? Do what you can to try to keep the body moving. Pay attention to your body's urge to have a bowel movement. Don't delay it or ignore it. So if you're getting those signals from those nerve endings that you need to go, you should try to go. You know, sometimes it's difficult because, you know, bathrooms aren't accessible, but we do the best we can not to ignore those urges. Our bowels respond well to routine. So 20 to 30 minutes after a meal is normally the best time to get your bowels to move. So find a routine that works for you. And like I said earlier, if getting to the washroom is an accessibility issue, then maybe you want to plan your meals and that time after when you're going to be close to your own toilet or somewhere where you can get to a bathroom. Another good thing that I tell patients is to keep a bowel diary to record your bowel movements. So sometimes you can kind of track what you're eating, what's working, did you have a bowel movement, what was the consistency today, so on and so forth. And then you can always review that with your dietitian or your nurse, okay? So another big one is positioning for bowel movements. This is something that we might not necessarily think about, you know. If you look on page 3 in the little handout I gave, there is a little picture there that kind of shows here. So on the toilet, you want to sit upright and ensure you are leaning forward. Rest your elbows on your knees. And you also want to ensure that your knees are bent and higher than your hips. Feet are resting on the ground or on a footstool. Now, for those that are having issues with the feet touching the ground or getting that correct bend, there's a lot of toilet squatting stools available to assist with positioning. So some of the brands that are popular out there are Squatty Potty and Step and Go. And I did a little search on Amazon, and they cost about $30 to $40 in range. So pretty easy to get off Amazon if you want to give them a try to help get that correct positioning. For those that have to have a bowel movement in bed, positioning in bed, ideally lying down and on your left side. And that's just because of the way the bowel is positioned in the body. So if you have tried non-medical management and you're still having issues with your constipation, please consult your clinic nurse or family physician. Consultation with neuromuscular dietitian is always available to assess your diet and ensure adequate fluid and fiber intake. So contact us for more information so we can help you, okay? Because we kind of want to exhaust all the non-medical before you start getting into medical, okay? So now we're going to talk a bit about the different options that are out there for, you know, we otherwise call them as laxatives, all the different medications. But I always advise you to, you know, speak to your family physician or the pharmacist or nurse or somebody before you start introducing these. Because of course, overuse and using them improperly can cause issues as well, which we'll talk about in a little bit. And everybody's different too, right? So that's why it's always good to have that bowel diary and kind of talk about things. So stool softeners, you've probably heard of those. They work by allowing water and fat to infiltrate into the stool and make it easier to move. So these are suggested a lot of the time for those who should avoid straining and that have temporary or mild constipation. An example of a stool softener would be Docusate. Next is the bulk forming laxatives, otherwise known as fiber supplements. They add bulk and water to your stool and make it easier for the stool to move through the intestines. Now they can cause abdominal bloating, so starting with a low dose and slowly increasing the dose over time is recommended for those. They should be taken with lots of water and they can take up to 3 days to work, so they're not a quick fix. Examples of these are like Metamucil, Citrusel, Fibercon, and then we have our stimulant laxatives, and I'm sure a lot of you are familiar with these. They make the colon contract. You take them at bedtime and they work overnight between 8 to 12 hours. Most common side effect would be abdominal cramping. They are very powerful and should be used occasionally. Prolonged use of them can create a dependence and actually make constipation worse. So examples of these are Senna and Bisacodyl. And then there's hyperosmotic and saline laxatives that work by drawing water into the colon and stimulate a bowel movement. So saline laxatives like Citromag, Make of Magnesia, they work quite quickly within 30 minutes. PEG and lactulose are also examples of hyperosmotic laxatives and work over 1 to 3 days. And then there's the lubricant laxatives, which act as a lubricant and will coat the stool in the rectum and help the stool move through easier. An example would be mineral oil. And then there's our rectal laxatives, suppositories, enemas. And these are used when oral laxatives are no longer effective. And there's bisacodyl and glycerin suppositories, phosphate or oil enemas. And there's a little, for your reference in the handout I gave you, there's a little bit more information on those there, just because it's a lot to remember. And there's also on the back in that handout some natural remedies that you could try at home. So we'll talk a bit about, overuse of laxatives, the harmful side effects. So this is why we want to be careful and we don't want to be overusing things or taking them inappropriately. So dehydration, electrolyte imbalances, tachycardia, stool incontinence, headache, diarrhea, decreased motility in the colon, and then last of all, they can make constipation worse. And that's basically all I have to say, just a quick little overview. We'll let Tiffany go ahead and we can do questions to both of us at the end if you guys are okay with that.
Thanks, Christine. So my name is Tiffany Lafleur. I'm the dietitian. I met you last week. I'm doing part 2 today of my nutrition and neuromuscular conditions presentation. So I'm just going to do a brief overview of a few specific topics. Bowels, as Christine mentioned, I'm going to go through fluid and fiber requirements, some eating challenges, some prednisone recommendations, and then a little bit about supplements. So fluid, Christine had mentioned how important it is to make sure you're meeting your fluid requirements. If you are at all dehydrated, there's not enough fluid available for your bowels. So you can imagine that then they would be dried out and harder to pass. The best indication is the color of your urine if you're not taking any medications or vitamins or minerals that can darken it. So usually the first void in the morning is going to be darker, but later in the day you want it to look more like diluted lemonade. So if it's looking more like concentrated apple juice, let that be a cue or reminder to yourself to try to drink more fluid. You do want to try to spread your fluids out throughout the day. Getting a third of your fluid requirements at one time isn't going to be as helpful as if you can spread it all out. If you find you're having to wake up in the night to void, try and meet your fluid requirements earlier in the day and stop drinking around dinner time so that you don't have that urge in the middle of the night that's interrupting your sleep. So once you've increased your fluid intake, if you need to, then it's recommended to increase your fiber intake if you feel that you need to. Don't do it the other way around, because if you increase your fiber first without ensuring you have enough fluid, that can actually make you more constipated. It can dry your stool out. So fiber is really important. It has many benefits to us. It helps to promote bowel regularity. There's 2 different types of main fibers in our food. There's insoluble fiber and soluble fiber. So insoluble fiber is the stuff we don't digest at all. It's like the typical roughage that helps to keep the pipes clean. It moves things through faster. There's soluble fiber, which has a slightly different benefit. It helps to draw water into our stool to keep our stool soft. And it's also the fuel for the healthy bacteria in our gut. And it's also called prebiotics. It's important to ensure you get that for that benefit as well, to enhance the healthy bacteria that resides in your gut. And that can in turn help to enhance gut motility. When Christine was talking about the whole movement of the GI tract, having a good balance of healthy bacteria can promote better gut motility. Fiber also helps to control blood sugars. It slows the digestion of food so that the sugar doesn't get released into your bloodstream as fast, giving your insulin more time to deal with it. And it can also help to lower cholesterol because it directly binds to the LDL cholesterol, which is L for lousy, that's the bad stuff, and it excretes it in your stool directly. And if it can also keep our portions in check because it helps us to feel fuller off of a smaller portion. So we know the benefits of fiber now. How do we increase our fiber in our diet? Basically, the goal is to include fruit or vegetable at each meal and snack and choose whole grains. If you're doing that as best you can, you'll likely be getting close to meeting your fiber requirement. The DRIs, or dietary reference intake for fiber, is 25 grams of fiber for women and 38 grams of fiber for men. So just to give you an idea of what that might look like, if you're getting fruits and vegetable with each meal, a typical fruit or vegetable has about 2 grams of fiber. So if you had 8 servings of fruits and vegetables in a day, which is a lot, most people don't consume that much, that's still only 16 grams of fiber. So you really need to make an effort to try to get whole grains in as well. So I just have some tips up here that help to implement this goal. Add fruit to your cereal in the morning. Prepare pre-portioned vegetables to quickly grab to pack in your lunches or have as snacks. People often tell me that increasing vegetable intake is too much work. So if you can do some of the work when you have more energy, cut them up, put them in an airtight container, or even buy vegetables that are already cut. There's a good variety available at grocery stores now so that you can have them on hand at home, and it takes away that extra step of prep. Add grated vegetables such as carrots and zucchini into sauces and casseroles, such as pasta sauce. So you could take tomato pasta sauce and add in some grated zucchini and carrots. You don't even know they're there, but you're increasing your fiber and your vitamins and minerals. Find interesting and flavorful ways to prepare vegetables that you don't always do. So for example, barbecuing vegetables in warmer months or roasting them in colder months to enhance the flavor and make it more palatable for yourself and exciting to eat vegetables. Add high fiber cereal like All Bran Buds or Fiber One in the morning to your cereal or yogurt. You wouldn't necessarily eat a whole bowl of that, but a small amount of those cereals goes a long way. It's about, they usually have 10 to 12 or 13 grams of fiber per serving. So you can see how adding that in would be an easy way to meet your fiber requirement. Sprinkle ground flaxseed on cereal, salad, or yogurt. So get creative by preparing a variety of whole grains. Try legumes such as beans and lentils and fruits and vegetables. And think about things that you haven't tried before that maybe you could experiment. So if you're someone who doesn't eat beans in your daily diet, we did talk about beans last time in the Mediterranean diet, consider a recipe that your family might enjoy that you could incorporate beans into your diet more often. Or are there any seeds out there that you would enjoy the taste of or that you could add to what you're already eating? So I'm just going to move away from fiber and fluid and just touch on some eating challenges. So sometimes people struggle with getting the right amount of nutrition in because they're too tired to eat, or eating a meal takes a long time, and this can result in weight loss or other situations where you're coughing when eating. And last week's session did talk about swallowing concerns. So if you do find that you're coughing when eating, definitely bring that up with your clinic nurse who can make the appropriate referral. But basically a solution that can cover some of these concerns is to try and eat small, frequent meals. And that sounds easy and sounds simple, but it can be tricky if you're used to eating 3 meals in a day and that's what your habits always have been. So think maybe you try to eat a smaller portion every 2 to 3 hours. Choose higher calorie and higher protein foods, and then emphasize those nutrient-dense foods first. So eat higher calorie foods like meat or carbs with added fats before you would eat fruits or vegetables, so that you can, even though I just said the importance of fruits and vegetables, but if you are losing weight, you do want to prevent that from happening. So just a note about increasing calories and protein. Add in fats to your diet. Fats contain 9 calories per gram versus protein and carbohydrates only contain 4 calories per gram. Choose full fat dairy products. Add smoothies and milkshakes. When we consume fluid, it's easier to get more calories in because fluid doesn't make us feel as full as solid foods, and it empties out of our stomach faster. And then on that note, sometimes nutritional supplements such as Boost and Ensure may be a helpful way to get in more calories and protein. If you do need help gaining weight or maintaining your weight, contact your clinic dietitian. So I'm just going to talk about a few side effects relating to nutrition and prednisone. Prednisone is used in certain neuromuscular conditions, but if this doesn't apply to you, the information still will, because a lot of the information is basic healthy eating, just more emphasis tying it back to prednisone nutrition-related side effects. So some of those side effects that do relate to nutrition are increased appetite, indigestion and bitter taste, bone loss, increased blood sugars, increased blood pressure, sodium and water retention, reduced potassium, increased cholesterol, and muscle wasting. So these side effects may not happen, and they're more common at higher doses for longer durations of therapy. But there are some things in diet that we can do to be mindful of these things. So one thing is appetite. There is a difference between appetite and hunger. So appetite is more the desire to eat, whereas hunger is the need for food, where you feel that hunger in your stomach. Your stomach is growling, you might feel symptoms of low blood sugar. So there are some things that people can do to control their appetite if they're finding they do have an increased appetite. Meal timing is a big one. If you're going longer than 5 or 6 hours without eating anything, by the time you get to your meal, you're probably going to be starving. So you're going to eat a larger portion than you would otherwise want to. On the flip side of that, if you're grazing all day long, that's no good either, because it might be easy to get in more than you need if you are doing that. If you're not consuming enough protein or fat or fiber with your meal, all of those components help to contribute to the feeling of fullness after you eat. That might result in an increased appetite. And same with your habits and your environment. So a big thing about your environment is, do you eat at the kitchen table? Do you eat while getting ready? Do you eat while watching TV? If you are doing another activity while you're eating, that promotes what we call mindless eating. So it's easy to eat a meal and it doesn't compute that you actually ate the meal. So it is important to reserve some time to fuel your body and sit at the table and appreciate the food that you're eating, so it does send the signals to your brain that you actually ate something. Go through a couple slides about meal timing. So I did mention this briefly. Are you eating regularly? And then is what you're eating at meals and snacks adequate? So those two are the most important considerations with appetite. So you do want to find a pattern that works best for your lifestyle and choose a pattern that's going to allow you to be able to plan ahead for healthy eating. So for example, if you wake up early, maybe you need to plan ahead the night before for breakfast so your morning routine isn't rushed. So this is just an example of 3 meals and 3 snacks. Like I said, you don't want to go more than 5 to 6 hours without eating. So if you, sometimes people might do that between lunch and supper. If you eat lunch at noon and you're not eating supper till 6:30, that can be a long period of time to go, and you might consider having an afternoon snack, something that contains both carbohydrate and protein, so it can tide you over until the next meal. I mentioned this last week, and I will mention it again because fruits and vegetables are really important. So they increase our fiber and they increase potassium. So if you do have low potassium or even high blood pressure, increasing the dietary potassium that you eat can help with that. And many fruits and vegetables are an excellent source of potassium, not just bananas. So eating a variety will help to increase that. And then, as I mentioned previously, it helps us to cut back our portions of grains and meats if needed. Huge source of antioxidants, adds color to our food, and they taste great. I'm just going to talk a little bit about sodium, and this is in here relating to the prednisone and the water and sodium retention, but most people can use to reduce the sodium in their diet. So the goal is 1,500 to 2,300 milligrams per day. And most people say to me, oh, well, I don't add very much salt to my food, so I don't eat that much sodium. The problem is the salt that you add to your food only accounts for about 12% of your total sodium intake. Most of the sodium from our foods is coming from what's been added into foods or from eating out. So do try to read labels wherever you can. 5% or less is your goal for choosing foods. And I just have a couple of examples here so that you can visualize how it might add up to 2,300 milligrams, which is the upper range of where you would want to be. A pack of instant oatmeal, which is not really a salty thing in my mind, is 190 milligrams of sodium. So to put that into perspective, something that's less than 140 milligrams of sodium is considered low sodium. So they're not allowed to label it as low unless it's less than that. If something is 500 milligrams or more, I would recommend trying to find an alternative at the grocery store. So while you're standing there, look for another product that might be closer to that or lower them. A cup of Shreddies cereal is 300 milligrams of sodium. A half a box of Kraft Dinner macaroni and cheese is 740 milligrams of sodium. A half of a cup of commercial pasta sauce, like the jarred spaghetti sauce, the tomato-based kind, is 460 milligrams of sodium. An alternative to that would be buying diced tomatoes that don't have salt added and then cooking that up with some meat and garlic and olive oil to flavor it instead of relying on the sodium. Half a can of canned soup is 850 milligrams of sodium. A couple more examples here. Frozen lean cuisine meal is 720 milligrams. A fillet of frozen breaded fish is 550 milligrams. So again, if you're at the grocery store, try to choose products that are lower. Sometimes you're not going to be able to find that, and that's okay. Most of the time you want to try to choose lower sodium alternatives. 4 pierogies is 420 milligrams of sodium. My husband would eat 16 pierogies easily in a meal, so then multiply that by 4. Just for fun, I put a Big Mac and fries on there, which is 1450 milligrams of sodium, and a Boston Pizza individual pizza is just about 3600 milligrams of sodium. So the reason for putting those last two on there is just to say that it's not that those food establishments are doing unhealthy things, it's just eating out in general is very tricky to monitor many things, but for sure the number one is sodium. So where you try to maybe choose a lower saturated fat food when you're eating out, then maybe the sodium is still up. Like it's very, very hard to find low sodium foods when you're eating out. So just moving away from sodium onto calcium and vitamin D. I mentioned if you are on prednisone, it can promote bone loss, but everybody needs to make sure their calcium and vitamin D requirements are being met. So there's just a little quiz here. You can think about the answers to yourself. How many cups of milk would meet an adult's calcium needs? True or false, the fat content of milk affects the calcium content. And true or false, 1 serving of broccoli will provide the same amount of calcium that is in a cup of milk. So you can think about what your answers to those questions might be. So to meet an adult's calcium requirements, you would need 3 to 4 cups of milk if that was your only source of dairy. Adults require between 1,000 and 1,200 milligrams of calcium. If you're over 50, it's 1,200 milligrams. There's about 300 milligrams of calcium in a cup of milk. The fat content of milk does not affect the calcium content. So no matter what type of milk you choose, it's all going to have about 300 milligrams of calcium. And 1 serving of broccoli does not provide the same amount of calcium that is in a cup of milk. You would need 9 cups of broccoli to get 300 milligrams of calcium. So you can see that on this chart here. There's half a cup of broccoli is 33 milligrams of calcium. It is tricky to meet your calcium requirements if you don't consume dairy or dairy alternatives that are fortified with calcium. So in some instances, you may require a calcium supplement. However, as Christine mentioned, calcium supplements can be constipating. So you want to make sure that your bowels are running smoothly before adding on a calcium supplement and that you're doing the lifestyle measures that you can to keep them running smoothly. This is an example of somebody's food intake. So when I see people, I always go through a typical day's worth of eating and make evaluations. So with this person, she has milk on her cereal in the morning, and then she takes her calcium and medications in the morning. She consumes yogurt with lunch, and then there's no other major sources of calcium in her diet. So in order for her to meet her calcium requirement, I would recommend spreading out the calcium supplement from that milk serving in the morning, because you can only absorb about 300 to 500 milligrams of calcium at once. And if you take more than that, your rate of absorption decreases. So then you absorb less and less. So I would suggest taking the calcium in the evening and then continuing with that serving of milk in the morning. And then at lunchtime, I would recommend choosing a plain yogurt because it does have a more dense, higher content of calcium than fruit-flavored yogurt, and then adding fruit on top. A note about yogurt is with all the rage of Greek yogurt out there, Greek yogurt is really high in protein. It's an excellent source of protein. It does not have as much calcium. So if you're choosing yogurt to meet your calcium requirement, you may consider choosing a plain regular yogurt rather than the Greek yogurt. But if you need to increase your protein, maybe you keep that Greek yogurt on board and consider alternatives to increase your calcium intake. It's always better to get things from diet if you can. So take a minute to consider, are you getting enough calcium? Do you consume dairy products? How could you increase your dietary calcium? Do you need to consider a supplement? Here's another quiz. True or false? If you meet Canada's food guide for dairy servings, will you get enough vitamin D? So the answer to that is false, unfortunately. This is one of those nutrients that is pretty tricky to meet our needs through diet alone. Ideally, we would get vitamin D naturally. To do that, you make it in your skin from the UV rays of the sun. Well, for one, we live so far north that there's only enough UV between the months of March and April to September, October-ish. And even during those months, you really should be wearing sunscreen. So that blocks your body's ability to make vitamin D. Therefore, that brings us to the whole supplement thing. You likely need a supplement to meet your vitamin D requirement. As you can see, it's just not that abundant in food. So if you did consume 3 cups of dairy in a day, you'd only be getting 300 international units of vitamin D. Salmon, canned salmon, is a really high source of vitamin D, but I haven't met anybody who consumes that on a daily basis, so it's still tricky to meet your needs naturally. There is a bit fortified in margarine, and it is fortified in some other foods now too, but again, still not in high amounts. Vitamin D is different from calcium. It's a fat-soluble vitamin and it's very well absorbed, so it doesn't matter when you take it. So people always ask me, should I be taking other supplements? And as a dietitian, I promote diet. So I always promote getting nutrients from foods as best we can. It's hard to replicate the vitamins, the minerals, the phytochemicals, the antioxidants into a pill. So it's by far best to eat the best way that you can. If you can't, there are some instances where supplements are recommended. An example would be the vitamin D or maybe the calcium. Omega-3 is another example because some people really struggle to eat 2 to 3 servings of fish in a week, and then some people would argue that that's not sustainable anyways. So there are some considerations with that. If you are considering a supplement or you are taking a supplement, I always recommend running it by your healthcare provider, whether it's the nurse in the clinic, your physician, or myself, the dietitian. We can always review them and make sure that they're safe or even check if they are effective. Problem with supplements is they're not necessarily well regulated, so they don't always contain what the bottle says it contains. And there have been studies where, I guess whistleblowers you could call it, they've taken products and examined what's in them versus what the label says, and there's sometimes none of the active compound in the supplement, let alone what the label says it contains. So an example of this is probiotics, and I didn't really talk about probiotics today. I mentioned it briefly, but consuming enough probiotics can help enhance that healthy bacteria in your gut. In some cases, that may help with constipation. We don't have good evidence proving this, so this is one of those things where, well, if you want to make some modifications, it may or may not help. It may be worth a try. But so there's a lot of probiotic supplements out there, but the question is, do they contain what the label says? And if they did at one point, are they still viable? Or are they still alive? So one alternative way to get probiotics in is from food. So kefir, for example, I mentioned this last week, the probiotic milk. that the dairy industry is very well regulated. So if that label says it contains all of those healthy bacteria, it's going to contain it. I just wanted to briefly mention that there is some evidence for creatine supplementation in that it improves muscular strength with those who have muscular dystrophies. Studies did not find improvements with metabolic myopathies, and it's not recommended to those with McArdle disease. But if you do have any questions about that, definitely bring it up with your healthcare provider. So if you want to learn more, I had these posters up last week. I do a cooking group as well as a Living Well on Prednisone class. And in the new year, I'm going to collaborate with the speech pathologist to do a swallowing and increase calories and protein class, or it's going to be a hands-on cooking group in the kitchen actually. And I do have information sheets on the topics I went through today that I can provide you. I can either mail them to you or email them to you. My cards are here, so I can provide you with my contact information today. If you're interested in that, you can just contact me via email or phone, and then I can send you whatever information sheets you want, or you can come in for an appointment if you'd prefer.